think Singapore, we have a few initiatives. I think I'll ask DMS to elaborate on from the scientific angle. There are some research work that's ongoing, collaboration between us as well as overseas partners in developing some of these potential candidates. And there are quite a lot of work going on, not just in Singapore, in various countries, and we are participating in quite a number of them. And in terms of securing supply of vaccines, we announced earlier that Singapore is participating in the COVAX facility, and DMS can also elaborate further on our participation. But some of these transactions and our strategy is strategic in nature, and there's also some business confidentiality involved, so we may not be able to share with you all the details, but I think suffice to say that Singapore is working quite proactively in discussing with the various vaccine developers, pharmaceutical companies, research institutions on both collaboration on research efforts as well as advanced procurement to ensure that we are able to have access to early access to vaccines that will become available in time to come. And I think it's not going to happen anytime soon. Vaccines probably, I think the earliest maybe end of this year, or which is I think it may be quite unlikely. It's more likely to be sometime next year, maybe even the middle or second half of next year. So we'll ask DMS to elaborate further.
Thank you very much, Minister, and thank you for your question as well. Indeed, we are extremely interested in working with various pharmaceutical companies and also on the international front collaborating with a view towards being able to gain access to promising vaccine candidates. Once proven that these vaccines are efficacious and safe, it is our intent to bring as many of these vaccine doses into Singapore such that it can benefit our population. We are not banking on any particular individual vaccine candidate, but we have attempted to diversify our approach. That includes promoting and encouraging research to be done to identify promising vaccine candidates, bring them through the required phase 1, 2, and 3 trials, and eventually deliver a promising vaccine into the market. We have researchers in Singapore who are active in this particular area and are working to produce a locally produced vaccine even in Singapore. There are other pharmaceutical companies that may be keen on producing their vaccines in different areas in order to improve access globally of their vaccine to different countries. We hope that some of them may find Singapore attractive enough to consider Singapore as a production base for some of these vaccines. Certainly on an international front, we are collaborating with various companies as well as on the international front at WHO. Minister has mentioned the COVAX facility. We have registered our interest to participate in this COVAX facility. Currently, many discussions are in place right now, working through those operational details, and many of the discussions remain at quite an early stage, and it's premature to make definitive announcements at this stage about whether or not a particular vaccine would be de-vaccinated, that would be used, which would be procured, how it would be allocated, how it would be distributed. Those are details that's premature at this stage because these discussions are still continuing. In regard to a timeline, there are some of the companies who appear to be leading the pack, so to say, by making announcements that they've started phase 3 trials in various places around the world. But we do know that even if they are in this relatively later stage of the journey towards researching for promising vaccine, there may sometimes be successes, but there may still be failures in terms of delivering a safe and effective vaccine. And therefore, we remain watchful. While some of the studies have started this year, practically speaking, we expect perhaps realistically a vaccine to be available perhaps next year rather than this year. And given the global demand for these vaccines, it may not even be in the beginning of next year, but perhaps towards the end of next year, where we might see vaccines produced in sufficient doses and available then for procurement and to be delivered into Singapore. So we continue to work on this space. We hope to get a vaccine for Singaporeans to benefit from as soon as is possible. At this stage, we don't know which of the vaccine candidates will be the one most likely to be delivered and brought into Singapore. But we continue to work at making sure we have access to those vaccines, and we will continue to work on in this space.